Really happy to really happy to be with you all this morning. So, as I understand, this is a pretty informal format, so please feel free to jump in and ask questions as we're going. But otherwise, I will just sort of share some material that I have put together that I thought may be of interest to you all. But again, welcome any questions that you have as we go. So again, my name is Cora Steinmetz, and I am the Indiana Medicaid Director. I have been in this role since August 14th. So it's been a whirlwind sort of 90 days, a little bit more than that now. But really excited to be here. Before that, I served as Governor Holcomb's Health Policy Director, and so had the opportunity to work very closely with Family and Social Services Agency, the Department of Child Services, Department of Insurance, and the Department of Health. And before that, I was in a variety of legal revenue cycle compliance and government programs role at a large hospital system here in the state. So that's just a little bit about my background. I thought it might be helpful if I share a little bit about OMPP and how we're situated. I know that many of you are very familiar with the Division of Mental Health and Addiction and work closely with Jay and his team. So Jay and I when I was in the governor's office, Jay and I worked very closely together and appreciated the opportunity to have that relationship. And now that I am over here in the Family Social Services Administration, it's been really great to work with what we refer to as our sister division. So Medicaid is sort of the financing structure for a number of the divisions beyond just the Office of Medicaid Policy and Planning, which is where I'm situated. We have the Division of Mental Health and Addiction, like I shared, and not all funding for these divisions comes through Medicaid, but sort of the unique braiding that's going to take place when we talk about like CCBHC and other areas will, I know, be of interest to all of you. The other divisions that I work really closely with include the Division of Disability and Rehabilitative Services and the Division of Aging. And as we think about where we're headed with the Indiana Pathways for Aging program, certainly those two divisions are working hand in hand with my team as well. Other divisions within FSSA, of course, we spend a lot of time with as well. 211, a lot of resources there that connect our Medicaid members to other areas, as well as sort of our shared services across the agency. So with that, I have just a few quick slides that I'll get pulled up here to share with you all. Give me 1 second here. Okay, great. Are you seeing that right now?
Yes.
Okay, great. Thank you. So these are the 2023 strategic goals for the Office of Medicaid Policy and Planning. So you can see culture and our team development is really important. We have about 140 individuals working here in OMPP. So as size-wise, we're actually one on the smaller end of the divisions, but of course we have a lot of contractor support as well. The Pathways launch, as I mentioned, is another big area that we're working on as we go closer to our July 1st, 2024 go live there. Behavioral health initiatives, like I mentioned, working closely with DMHA on the CCBHC model and the build out of the crisis response continuum. Then, of course, the return to normal operations, end of the federal public health emergency, all those things are really just the first time that individuals have had to be redetermined for their Medicaid eligibility since the start of the federal public health emergency in 2020, March of 2020. And then our rate matrix, which is really just a fancy word for a schedule of rate updates. And so we're really excited to have partnered closely with the legislature in last session to create this rate matrix into law and have it be an area that we work on a biennial budget basis with the legislature to continually update. So I'll go through this really quickly, but just a few items that may be of note to you all. This is a breakdown of our OMPP team. So you can see that we're divided really into subject matter areas of expertise. Our care programs team manages each of our managed care programs that work really closely with our MCEs or managed care entities. Our clinical operations team is a quite a large team, and that's where sort of our medical director, pharmacy, coverage and benefit decisions, quality and UM teams are housed. Our eligibility and member services team, that's the team that's been really busy with all of these unwind activities and dealing with things like presumptive eligibility and our member experience work that we're doing. Reimbursement and actuarial services, of course, is kind of divided up by different provider types. I won't go through this because I'm sure many of you are familiar with it, but this sort of breaks down Medicaid at a whole. So CMS, of course, is the lead federal agency from the Medicaid standpoint. And there's really two different vehicles for the way in which Medicaid services are delivered. There's the Medicaid state plan, and then there are waivers, which are simply a waiver of a federal law. And Indiana has a number of waivers. There's Department of Mental Health and Addiction waivers, as well as our traumatic brain injury waivers, home and community-based services waivers, et cetera. We also have two delivery systems in how we execute those state plans and waivers via fee-for-service and managed care. So fee-for-service programs are managed here by the state. The claims are paid directly by the state. processes are handled by a vendor contracted directly by the state. And that differs from managed care, which is where we have one of our managed care entities doing that work for us in terms of all aspects from claims payments to to provider network and adequacy issues. As you can see, the Medicaid assistance budget is a growing portion of the state budget.
Cora, sorry to interrupt you real quick. Are you meeting to advance any slides, or did you still want to be on slide 1?
Oh, I'm sorry. I wanted to advance. Let me see here.
We're still kind of at that. Yes. Okay.
How about now? Okay,
yes.
Sorry. So this would my speech, a little spiel about the Office of Medicaid Policy and Planning would have made a lot more sense if you had this slide in front of you. But hopefully you can see that that's how we're broken up here. And then this is the slide that I was just on, talking about the sort of the federal and state perspective of the state plans and waivers, and then the percentage of the state budget. So Medicaid represents almost 20% of the state budget, second only to education. We'll sort of jump around here a little bit, but I did want to show, this is how a Medicaid snapshot of how we have the light green shows those that are in managed care programs, and the dark blue are those that are in a fee-for-service program. So again, as I mentioned, an area that we internally at the state manage. That dark green 6% is the piece that will move over to our managed long-term services and supports, or Indiana Pathways for Aging program, on July 1st. So really quickly, this is a snapshot of Medicaid enrollment, and I'm sure that the numbers are a little too small for you to see, but you can see that we peaked right about 2.26 million Medicaid members before this beginning of the unwind period. Since then, we've started the redetermination process. We've also rolled out a dashboard. We're really pleased with the outcome of this, and I know many of you may have seen this before or been involved in stakeholder calls, and so we really appreciate the provider community and the work that they've done to assist us in reaching as many members as possible to ensure that we are getting the word out that redetermination packets have arrived at people's doors, and they need to return that information in order for us to redetermine their eligibility. Our main goal here has been transparency and ensuring that everyone who remains eligible or who is still eligible remains on Medicaid and has a form of health coverage. So we'll skip ahead a little bit here because I know we're short on time, and I definitely want to leave time for questions, but did just want to highlight our Pathways for Aging program because of the overlap that we're seeing in sort of co-occurring issues, especially in the Alzheimer's population or other Hoosier seniors who are experiencing mental health issues. And so want to be sure that I highlight this for all of you because really need assistance from providers in answering questions that Medicaid members may have as we move to the managed care model on July 1st. So our goals with Pathways are really to ensure that Hoosiers have a choice in where they age and really to increase the opportunities for Hoosiers to age at home. We really went forward with the historic investment of HCBS related rates effective July 1st to really help build up the workforce here. And so another piece of this is really improving the quality, because with those rates, we hope that we'll see sort of an uptick in the service delivery and the quality that these providers are able to deliver. We're really also excited about the opportunity to do more dual alignment. So our individuals who are eligible and enrolled in both Medicare and Medicaid, allowing them opportunities to have a single care coordinator, more benefit coordination, and a greater understanding of how their benefits interact together. It's such a complex space. So we really feel that aligning membership for those individuals who might be in a Medicare Advantage program to one of our Medicaid MCEs can bring a lot of benefits. And then, of course, always looking at the sustainability pieces here and ensuring that we are working towards rebalancing. Indiana has a very high percentage of institutional nursing facility expenditures and enrollment, and a low proportion of home and community-based services, long-term services and support. So we really hope to see more opportunities for future enrollees to age at home and rebalance from an expenditure standpoint. So I'll skip ahead here. This slide, let me see if I can blow it up a little bit to make it a little easier to read. Wanted to just make sure that you had a chance to hear that members will receive plan selection notices. So again, this target population are individuals on our aged and disabled waiver today who are 60 or older. Those who are in, these are separate factors. You don't have to have each of these factors to be eligible. Nursing facility residents, individuals who are dually eligible, again, for Medicare and Medicaid. So it's about 130,000 Indiana Medicaid members. And they will receive a plan selection notice from an enrollment broker, which is a state vendor, Maximus, in February of 2024, allowing them to select a plan. And we have 3 plans coming on board for our Pathways for Aging program: Anthem, Humana, and United Healthcare. And so we will help members make a selection based on providers they currently see or what they'd like to see in their plan. Each plan offers enhanced benefits, and the brokers will be prepared to talk members through that as they're making their selection, or their authorized representative if they are unable to do so. And then from there, members will receive a welcome packet from the plan that they've selected in June that really walks them through what will happen on July 1st in the cutover. So we're really excited and dedicated to making this a very seamless transition. So we have specific information available at our website, which is our new website is in.gov/pathways. And so if you have any questions about this, first of all, we'd be happy to come out to your organization and have a specific conversation with you or offer a webinar specific to Pathways. I've just barely touched the surface of it here, but did want to just use this opportunity to kind of spread some more awareness, because it is really important from the behavioral health side of things, as we see more and more challenges for our aging Hoosiers related to social isolation and behavioral health needs. And the ability to stay home really does connect very closely to ensure that an individual's behavioral health needs are met. So with that, I know I flew through a lot of information. I'm going to stop sharing my screen so that I can see you all and answer any questions that you might have about this or really anything. These were just a couple topics that I thought may be of interest and something that you might not have heard previously. So happy to entertain any questions, or if there's not questions, that's okay too.
Yeah, thank you, Cora. Again, if anyone wants to put any questions in the chat feature, or just take a moment here to unmute.
Hey, Cora, it's Zoe calling from the road.
Hi, Zoe.
Hey, thank you so much for being on. And I understand about the slick roads and traffic as I'm trying to navigate that. But I know you and I had a chance to connect last week about CCBHC and some of the timeframes and Medicaid's involvement. Could you just give a high level, since that is definitely our number one priority from a CMHC, about where Medicaid sits with all this and what would be helpful from a provider standpoint?
Sure, happy to do that. So obviously, we're working really closely with DMHA, with Jay and Becky and their teams. So monitoring really closely sort of the demonstration project application and seeing what that happens. I'm excited to hear about the cost reporting training taking place, because obviously that will be a really big piece as we talk about rate development and the things like that. So later this month, there will be sort of an internal, some internal discussions and kickoffs to make sure we've got all the right people in the right places. Our teams have been working really diligently to get things moving along, but we want to make sure that we kind of are ready to operate under either timeline, assuming that we are selected as a CCBHC demonstration state, that we have everything we need. The role of the managed care entities, Medicaid will be extremely involved in that, helping DMHA have those conversations with our MCEs. Great to see Lissy on here as well. Appreciate their role, as well as our other managed care entities. So we'll be working really closely from a rate standpoint, from anything we can do to support DMHA on some of the quality pieces that come into play, and really have just been working to really spread awareness with managed care entities, with providers, to help them see. I would say one other thing that is exciting to me is at the National Association of Medicaid Directors Conference that myself and many of my teammates were at in October, many states shared sort of their successes in CCBHC from the Medicaid lens and offered to be a resource. So we have a sort of a network of other states that we're working with really closely on the Medicaid side to make sure that we can hear their lessons learned and talk about sort of things that have worked really well in their state to leverage that.
Great,
I'm sorry, Jenny. I was just gonna say, I did drop sort of our general inbox in there, which is monitored by my executive assistant and myself. So you're welcome to reach out to me with questions, or if you think of things afterward that would be helpful, resources, feel free to connect. I'm also going to drop in our provider relations inbox, so that if you have Medicaid related provider relations issues, mostly in the claims management space, or just they're happy to route your question to wherever. I've put that in the chat as well. So you're welcome to reach out to them. If you've worked with Michael Cook, that's his team. He's fantastic and has a lot of institutional knowledge.
Great. One more opportunity if anyone wants to unmute or type anything in the chat. All right. Well, Cora, thank you again. As a reminder, this was recorded. So I will be providing this recording up in our members only area of our website. You can download that. And you probably saw Leanne. She did drop our public policy platform in the chat. So if you do not have access to that, it's easy accessible right there in the chat, as well as it is up on our website. A few more upcoming events. December 13th, we do have a House Bill 1006 court services discussion. Information has been emailed out, so please reach out if you have any questions around that. And moving forward in 2024, Our Cup of Joe's will now be the second Tuesday of every month, same time. So if that's still too early for you, again, these are always recorded. So 8:30 a.m. Eastern time. Our first Cup of Joe will be January 9th with our lobbyist team to help us get ready for the legislative session. And then finally coming up in February 5th is our winter quarterly meeting. That is around our legislative training, and we will be going over to the State House to have lunch with our legislators. And then Tuesday, it's a little different here. Tuesday, February 6th will be the Indiana Council business meeting. So working on finalizing registration to have that up with you either today, have that up for you either today or tomorrow. So be on the lookout for that. And those are all the updates for me. Lissy, did you want to announce the Starbucks gift card winner?
Sure. So I used the participant list to make a wheel of names. So I'll spin it now. And it is Morgan Pritchett Taylor. So I will email Morgan and work on getting that gift card to her.
All right. Morgan with Park Center. Got it. All right. And if there's nothing else from anyone, raise your glasses here for our Duncan with Denise, and we'll be back to the regularly scheduled Cup of Joe with Zoe in January. Sounds like I need to hit the road with all the ice to make it to the Blue & Co training. So if I don't see you downtown, have a great rest of your day and see you soon.